Traffic has slowed after Lebanon's government ordered a lockdown. Private and state institutions are closed as daily life slowly grinds to a halt. It's the latest measure to stop the spread of coronavirus, but not everyone can afford to stay home.
I have 3 daughters. There's no work for a tile worker, so I'm forced to drive a taxi. I know my health is in danger, but I have no choice.
The government declared a medical state of emergency to keep the number of infections in check. While essential services like bakeries and pharmacies remain open, the country will be sealed off from Wednesday, with the closure of airports, ports, and borders. But some fear these measures are not enough.
The problem is many Lebanese are not taking the threat seriously. They ask us why we wear masks and gloves. One should protect himself.
Private health facilities are now on the front line of this battle because of the bitter reality of public hospitals. That's how the Prime Minister Hassan Diab described the situation as they prepare to face the pandemic. But doctors say the private sector too doesn't have the equipment and supplies to last over a month.
All the private sector is not ready to take this in charge, except a few major hospitals in Beirut. And these few major hospitals in Beirut can handle this task, but not for a very long time, because we have a huge shortage.
The government is under pressure on more than one front. It is almost bankrupt, and there's a deep economic crisis. The authorities are trying to protect people, but many are asking what they're doing to look after their livelihoods. Many say there is a need for a comprehensive response plan and a strategy to ensure the economy doesn't collapse even further. Some are taking personal initiatives to help those in need. Opponents of the government believe ministers and parliament members should work on retrieving what they say are stolen public money instead of donating this month's salary to a national fund set up to combat the virus. People are getting poorer.
Actually, it's been 2 months. The needs are getting very big because we got a lot of people outside the downtown coming to ask us for relief boxes with the rice, sugar, oil, and we're giving as much as we can.
Lebanon is facing many crises, but the fight against coronavirus is taking precedence. Health officials expect the number of infections to rise, but as they try to delay that, it is the most vulnerable who seem to be left behind. Sana Khuder, Al Jazeera, Beirut.